Hi, this is Karel Nakamura, and I was a summer intern for this past summer, and just finished my public health degree, and so I got connected to MCCC through the Community Health Initiative, which pairs nonprofit organizations that are doing health disparity work with students that are interested in doing this work, and it matches based on sort of experiences and interests. And so I'll talk a little bit about what my organization or what my internship was all about. So the main overarching purpose of my internship was to help MCCC improve program evaluation infrastructure. And so the three main projects were to research frameworks and best practices to assist with the qualitative ACE interface project. This was Maxine's project that she presented to the board, and so you probably saw that presentation already. And to compile, analyze, and report on FY16 program data, which is what I'll be talking about today. So first, to sort of lay the groundwork of what evaluation is. Evaluation has many definitions. One definition that was sort of set by the father of evaluation, Scriven, is the systematic determination of the merit worth of an object. And so his definition was pretty narrow, and it was kind of judgment focused. The second definition, which is more broad, is the systematic collection of information, and it has more sort of purposes. So it can be to make judgments about the program, to improve or further develop program effectiveness, to inform decisions, or to increase understanding. And then along these same lines, one of the definitions that my instructor, Gene King, used was a process of systematic inquiry to provide sound information for a valued purpose. So what these definitions sort of have in common is it's a systematic process. So you go about it in a systematic way. It involves collecting data, and it's a process for enhancing knowledge and decision making, or for a valued purpose. And there's sort of two camps. So some believe that use is implicit, so that an evaluator shouldn't really be concerned with the usability, that their role is to do an evaluation, and then it's up to the people that are in the program to sort of use it. Whereas the other camp is that it's explicit, and that's sort of the framework that I use, is that use should be thought about in program planning, in collecting information, in analyzing information. So throughout the entire process, and then the evaluator should sort of provide recommendations that also help with evaluation usability. So at MCCC, the main evaluation purposes are program impact, goal attainment, program effectiveness, which are essentially saying the same thing in different ways. And then the second purpose is program improvement. So first I'll start with the ACE interface program. In FY16, there were 40 newly trained ACE interface presenters, which made about 130 total trainers and presenters statewide. These trainers provided more than 85 educational presentations to more than 1,700 individuals in 26 counties. There's a big summary that you can reference that will show sort of all the different graphs and interpretation and the open-ended questions with respondents, different responses, and but I'll highlight a few of those here. The first thing I want to highlight is actually from Maxine's project. So it was the interview. It was a project that interviewed ACE interface trainers. And so you saw that presentation, but what you probably didn't see was sort of the thoughts on support section that we wrote up. And so some of our recommendations based on things that ACE interface trainers said, either positively or areas for improvement, we glean these recommendations from what they said. So create more opportunities for presenters to connect in the training and afterwards. And along those same lines, foster networking between presenters using different media. So different media because presenters are geographically dispersed throughout the state of Minnesota. And let presenters know what other presenters in the network are doing and connect presenters that are doing similar work. So these two things are some of the trainers talked about that they wanted to connect with other presenters for support, for sharing resources, for shared learning, for a variety of different purposes. But they said that they really valued these opportunities and they really wanted that networking piece. And the third recommendation was to continue to disseminate resources, updates, and new information related to ACEs to presenters. So ACE trainers really wanted to make sure that the information that they're presenting is up to date and wanted those resources to incorporate into their trainings. And continue incorporating information on historical trauma and ensuring trainings are culturally relevant. So trainers talked about just how historical trauma is really the base of a lot of adverse childhood experiences and personal trauma. And so continuing to incorporate that into the training that MCCC provides to ACE interface trainers, but also sort of supporting ACE interface trainers as they try to incorporate it into their trainings in the best way possible. And provide guidance around next steps to trainer. So trainers talked about wanting to take this education and this training and really put it into action and wanting some guidance around the best ways to do that in the state of Minnesota and provide support moving from training to certification. So these were more talking about different barriers that trainers faced in trying to get certified. Provide guidance on adapting material while ensuring fidelity to the program. So this trainers wanted to adapt their material to really fit with their audience or adapt material to incorporate other things that they were trained in or whatnot. And so they had some questions about how do they ensure the fidelity of the program, but also make sure it's adapted in the way that they want. And in those trainings also give a comprehensive background of MCCC and the ACE interface program. And so talking about MCCC, what MCCC does and how ACE interface fits into their other programs, and then also what the role of ACE interface itself is in this program. and then continue to evaluate the program and collect feedback for program improvement and to demonstrate program effectiveness. So one graph that I wanted to highlight was from the ACE interface survey. So this is a survey that had respondents that were participants of the trainings from those ACE interface trainers. And so there were 424 respondents, and in this you can see that 89% of those training participants said that they were likely to incorporate this knowledge about ACEs and resilience into their actions in their work, and 87% said they were likely to incorporate it at home or in their family. So now I'm moving on to the cafe conversations and trainings. There were 4 cafe events for more than 39 community members, and there were 5 regional trainings to 81 individuals. These 5 trainings were on emotional intelligence. The cafe was on a variety of topics, one being how to improve educational outcomes for African American children. And there were 10 webinars with 17 participants that participated in at least one of the webinars. And these webinars were coaching series. So from the cafe survey, this was a quote from one of the participants. What a great way to interact with each other, hear new ideas, get additional resources, share some of my own concern, and make a few friends. This from the emotional intelligence training, basically 100% either strongly agreed or agreed that the trainer was knowledgeable and easy to understand, that the trainer was able to help them transfer learned knowledge and or skills to their specific family, community, and or job, and 99% said that the information was clear and concise. In the coaching webinar series, the average rating of the level of understanding of coaching was 2.86, which we were looking at a 5-point scale. So 1 being poor, 2 being fair, 3 being good, 4 very good, and 5 excellent. So you can see that before the training, the average rating of level of understanding was just under good, but after the training, the average level was very good. And so there was a significant increase in the level of understanding of coaching. And for Circle of Parents, sorry, one second. For Circle of Parents, there were over 1,300 parents in 42 parent groups in fiscal 16. There are 815 children participants in 25 children's groups throughout the state of Minnesota. And in these groups, there were more than 1,020 referrals to resources, which included social services, mental health, public health, etc., that were made to the parent participants. One of the things I wanted to highlight was I created a table that looked at different ways that participants were referred to the Circle of Parents groups. And the top places that they were referred from were correctional facilities, shelter facilities, and community education. Looking at the Circle of Parents training survey, so this was a survey that was administered to the Circle of Parents facilitators, and they said that their level of understanding of the training topic before, you can see that most of the respondents it was fair, good, or very good, but after the training, the majority of respondents said that their level of understanding was very good or excellent. And then the parent mentor program. There were 9 newly trained parent mentors, and they mentored 30 Minnesota families. The parent mentor survey, so this was filled out by parent mentors that participated in the training, and they said that they have a better understanding of the culture of CPS. They have better communication and relationship building skills, a better understanding of how to empower parents and help families involved in CPS. They see CPS through a new lens, and they feel prepared for their role as a parent mentor. And just across the board, 100% of participants either strongly agreed or agreed with all of those statements. And they also scored how well the content of this training addressed cultural issues and issues diversity very high. So the majority of participants rated this as excellent. And parent feedback. So this was a feedback from a parent who had received help from a parent mentor while she was going through the judicial system. She said, "This is a great program for women like us because we don't have no one when we first start. But having a mentor helps you look at things different and gives you hope. Thanks so much." And this was, I used her words verbatim. And last but not least, the Parent Leadership Program, or the PLCSP. There were 21 parent consultants that participated in this 3-year cohort. And last fiscal year, they provided approximately 1,500 hours of advising service provider, raising awareness statewide about family resilience and community needs, and enhancing their own knowledge and skills. So one thing that they did, that some of the parent leaders did, were community investment projects. And this ranged from things like holding a cafe to a training for Native American parents on parent resiliency, and one group did a program with youth where they talked about historical trauma and resiliency. And so 13 parent leaders did 8 community investment projects. And what they learned from participating, what one of the parent leaders shared about what they learned from participating in their CIP is that, "I learned about my leadership style, that I can be a model. I have been where you are. I have seen that the system is biased against fathers." And so building on a project that was done in November, I looked at the 5 sessions with the highest self-rated change in understanding of the session topic. So that's taking the average level of understanding before the training and looking at the average level of understanding after the training and comparing those two. And so the sessions that had the highest were the fourfold practice, the chaotic stepping stones design process, promised neighborhood session, community of practice, and design process. And some of parent leadership's feedback, and I thought this was really powerful. "Participating on this team has changed my life, my perspectives, and the trajectory of the lives of my children. Examples of what I've learned. I am more biased than I know. I can do hard things and change my own course. I have so much to offer the world." So next steps, I provided some recommendations based on my experience here this summer to MCCC, and I'm going to continue. I'm going to be on the data and evaluation committee, and they're really going to be working on Kate and the data and evaluation committee are really going to be working on those two purposes of really how do we demonstrate and measure program effectiveness, and how do we make sure we're collecting what we need to continue to improve programs and make sure that they are the best that they can be. So thank you for listening, and thank you.